Good evening students. Today we will discuss about shock. Shock एक ऐसा शब्द है, the word that gives shock to many people. If the patient is admitted in the hospital and relatives are given the information that your patient is in shock, so most of the relatives, they are in shock that what has happened. Similarly, when all of a sudden you declare that today's exam and you have to write the answers, so the students may go into shock. So these are the various things that you can say the shock. The shock can be because of some bad news, some horrible news, or you can say the theft that can give rise to shock, or car is stolen, that can also give rise to shock. But the shock, here we will discuss the shock that is produced in the physical body of the human being. तो ये एक ऐसा शब्द है जिसको सुनने के बाद जो पेशेंट के रिलेटिव्स अटेंडेंट्स होते हैं वो भी एक बार शॉक में चले जाते हैं, उन्हें भी समझ में नहीं आता कि क्या हो गया. So we will start whenever you write shock or any question or answer, so you must first pay attention on the question. So what is being asked? Suppose there is a question of 3 marks, write the definition of shock, its signs and symptoms. So you have to be very particular that you must 4 to 5 lines that can give the exact definition and the signs and symptoms of the shock. So here you should not mention that it is a, you can say, the hypovolemic shock, it is a septic shock, cardiovascular, neurogenic. So just have to give the common signs and symptoms of the shock along with the definition of the shock. So if you still want to say something, you can add that the various types of shock, you just give the name of the shock, that hypovolemic shock, cardiogenic shock, septic shock, anaphylactic shock and your neurogenic shock. That's all. If you find that the same question is of 5 marks, you can add in each section of the type of shock 1 or 2 line. If the question is give or write the management of the shock, in that case you have to give something that is common to every type of shock and 1 or 2 lines that will be specific to that particular type of shock. So you should not hurry, or you should not be very particular to fill 4 pages, 5 pages because the question carries 10 marks. So nobody is interested how much you know. So examiner is interested only in the fact that whatever is asked from you, whether you have understood that question or not. आपको वो क्वेश्चन समझ में आया कि नहीं आया, आपने जो उसका आंसर लिखा दैट इज़ पर्टिकुलरली टू दैट क्वेश्चन और नॉट. जो अगर आपने पूरा शॉक ही भर दिया उसके अंदर, तो इसका मतलब यह है कि आपने क्वेश्चन को ठीक से समझा ही नहीं. तो सिर्फ शॉक के बारे में आना does not mean that you have to write everything about the shock. Suppose patient comes with hypovolemic shock and you are a treating doctor and you clearly is seeing that the patient is having some kind of trauma from which the blood is losing. So in that case you have to be very particular to stop the bleeding and give the fluid to the patient. So in that case you should not go for too much. Too much means you should not be giving the treatment that is specific for the septic shock, neurogenic shock or the anaphylactic shock or cardiogenic shock. So these shocks are also given various names: distributive shock or you can say obstructive shock. So depending on hypovolemic shock. So depending upon the kind of things that happen in that particular shock. So shock exactly क्या है? So in a physical body, shock is derangement of the circulatory system leading on to hypoperfusion of the tissues and decreased level of oxygen in the tissues leading on to anaerobic respiration. When this anaerobic respiration starts, various inflammatory reactions also starts in the body and that give rise to various signs and symptoms. तो इसका मतलब ये हुआ कि if we go with the chart here, so that is, you can see abnormality of the circulation leading on to hypoperfusion, decreased oxygenation and impaired cellular metabolism. So you should be very much, just a minute. So you should be very much particular about what you have to write. So when you have given the correct definition of the shock, then you have to enumerate the various types of shock. So whatever is the cause of the shock, कोई भी cause है shock का, whether it is a hypovolemic shock, whether it is a cardiogenic shock, septic shock, neurogenic shock, anaphylactic shock, सभी तरह के शॉक में एक चीज़ कॉमन है, डिरेंजमेंट ऑफ द सर्कुलेटरी सिस्टम. जो सर्कुलेटरी सिस्टम है उसके अंदर जब प्रॉब्लम होने लगती है तो ब्लड फ्लो जो टिश्यूज़ पर जाना चाहिए एडिक्वेट, वो नहीं पहुंचता. वो ना पहुंचने की वजह से क्या है, ऑक्सीजन और न्यूट्रिएंट्स जो टिश्यूज़ को मिलने चाहिए वो नहीं मिलेंगे. जब ऑक्सीजन नहीं पहुंचेगी तो क्या होगा, जब डिरेंजमेंट होगा तो हाइपोपरफ्यूजन होगा, ब्लड सप्लाई कम हो जाएगी. ब्लड सप्लाई कम होने से टिश्यूज़ के पास ऑक्सीजन भी कम पहुंचेगी. ऑक्सीजन कम होने की वजह से एनारोबिक रेस्पिरेशन शुरू हो जाएगा. दैट मीन डिरेंजमेंट ऑफ द मेटाबॉलिक एक्टिविटीज़. सो उन डिरेंजमेंट होने से एक इन्फ्लामेटरी सिस्टम रिस्पॉन्स जो होगा वो एक्टिवेट हो जाएगा, लीडिंग ऑन टू वेरियस टाइप्स ऑफ प्रॉब्लम्स एंड अल्टीमेटली failure of one by one organ, and ultimately if we are not able to control or the patient presents in the late stage, बाद में आता है आखिरी टाइम पे, तो ऐसे टाइम पे क्या होगा, ultimately the death of the patient. So it is very important to diagnose the shock in a initial stage and revert back to the ओरिजिनल स्टेट. समटाइम्स शॉक एक लिमिट के बाद जब पेशेंट आपके पास आता है तो मैनी टाइम्स इट इज़ नॉट पॉसिबल टू रिवर्ट बैक द शॉक. सो अब चलिए हम दूसरी स्टेज पे चलते हैं, दैट इज़, सो इन केस ऑफ सेप्टिक शॉक, हाइपोवोलेमिक शॉक, एनाफिलैक्टिक शॉक एंड न्यूरोजेनिक शॉक एंड कार्डियोजेनिक शॉक, इन सब के अंदर एक ही प्रॉब्लम रहती है, देयर इज़ disturbance of the circulatory system leading on to hypoperfusion, then deoxygenation of the tissues and the deranged metabolism of the tissues. सब में यही है. हाइपोवॉल्यूमिया में क्या है, आपका ब्लड वॉल्यूम बाहर निकल रहा है सर्कुलेटरी सिस्टम से और बॉडी से. जब बॉडी से बाहर निकल रहा है कि ऑब्वियसली आपको दिख रहा है कि फ्लूइड लॉस हो रहा है, नोजिया, वॉमिटिंग, लूज मोशंस में, या फिर ट्रॉमा हो गया, आपको दिख रहा है ट्रॉमा, आपके टांग में कोई मेजर वेसल इंजरी होगी तो वहाँ से आपका फ्लूइड लॉस हो रहा है, तो वो हाइपोवोलेमिक शॉक है कि जहाँ आपको ब्लड दिख रहा है दैट इज़ योर विजिबल लॉस, जहाँ आपको ब्लड नहीं दिख रहा निकलता हुआ, लेकिन एक्चुअल में वैस्कुलर सिस्टम से ब्लड बाहर जा रहा है, वो भी किसी कैविटी के अंदर इकट्ठा हो रहा है, जैसे कि आपका वो हो गया पेरिटोनियल कैविटी हो गया, प्लूरल कैविटी हो गया। ब्लड सर्कुलेशन से तो निकल रहा है लेकिन आपको नहीं दिख रहा है। सो दीज काइंड ऑफ हेमरेजेस आर नोन एज कंसील्ड हेमरेजेस। अब इसमें क्या हो, जब ब्लड वॉल्यूम कम हो गया तो अल्टीमेटली ब्लड प्रेशर फॉल हो जाएगा। ब्लड प्रेशर गिरने की वजह से टिश्यू परफ्यूजन कम हो जाएगा, टिश्यूज़ में ऑक्सीजन सप्लाई कम जाएगी, तो देयर विल बी एनारोबिक रेस्पिरेशन एंड डिरेंज्ड मेटाबॉलिक एक्टिविटीज़। Now comes to the septic shock. Septic shock is also known as distributive shock. एक्चुअल में इसके अंदर क्या होता है कि बॉडी से कोई भी फ्लूइड बाहर नहीं जा रहा, न ब्लड जा रहा है, न वाटर जा रहा है, न इलेक्ट्रोलाइट्स बाहर जा रहे हैं, बट द फ्लूइड इज मूविंग आउट ऑफ द सर्कुलेशन। सो हमारा जो ब्लड प्रेशर है, जो टिश्यू का परफ्यूजन है, वो ब्लड प्रेशर की वजह से मेंटेन रहता है। जब आपका टिश्यू परफ्यूजन ही कम हो गया किसी वजह से भी, दैट में बी एक्चुअल लॉस और फ्रॉम द बॉडी, और देयर इज नो लॉस to the outside of the body, but there is redistribution of the circulatory volume. सर्कुलेशन से बाहर निकल गया और बाहर के जो सर्कुलेशन के बाहर जो टिश्यू है, दैट इज़ द थर्ड स्पेस, फ्लूइड वहाँ इकट्ठा हो गया। वन थिंग। सेकेंड है द रेजिस्टेंस दैट इज़ प्रोड्यूस्ड बाय द वैस्कुलर सिस्टम इज़ मेनली बाय द आर्टीरियोल्स एंड द कैपिलरीज। दूसरा इसमें क्या होता है कि ये कैपिलरीज और कैपिलरीज जो हैं, दीज बिकम मोर परमिएबल। दैट मीन्स जो फ्लूइड अभी तक कैपिलरीज मेंटेन करके रखती थी सर्कुलेटरी सिस्टम के अंदर, अब वो फ्लूइड बाहर निकल रहा है, तो थर्ड स्पेस में वो बाहर जा रहा है। इसलिए पेशेंट को कई बार देखा है, शॉक वाले जो पेशेंट होते हैं उनका शरीर फूलने लगता है, बिकॉज द फ्लूइड इज़ मूविंग आउट ऑफ द सर्कुलेशन एंड गोइंग इनटू द इंटरस्टिशियल स्पेसेस। एक ये हो गया। दूसरा है, कई बार क्या होता है, दीज कैपिलरीज एंड आर्टीरियल्स दे डायलेट, वो एक स्पेस क्रिएट कर देते हैं जहाँ पे आके आपका जो ब्लड है वो पूल हो जाता है। पूल होने के मतलब है कि वो वहाँ आके इकट्ठा हो गया, ऊपर कार्डियक जो प्रीलोड जो है राइट वेंट्रिकल में नहीं पहुँच रहा, कम पहुँच रहा है। तो जब कम पहुंच रहा है तो लेफ़्ट वेंट्रिकल कम पुश करेगी, तो ब्लड प्रेशर गिर जाएगा। तो सेप्टिक शॉक के अंदर तीन चीज़ें हो गई। एक आपका लॉस फ्रॉम द बॉडी, लॉस फ्रॉम द सर्कुलेशन, इंक्रीज्ड परमेबिलिटी एंड इंक्रीज इन द कैपेसिटेंस ऑफ द कैपिलरीज एंड द आर्टीरियल्स। तो पूलिंग हो गई वहाँ पे ब्लड की, तो नेचुरली प्रेशर गिर जाएगा। जब प्रेशर गिर जाएगा धीरे धीरे हाइपोक्सिया होने लगेगा टिश्यूज़ का, तो उसके बाद उनका मेटाबॉलिक एक्टिविटीज़ डिक्रीज़ हो जाएगी एंड अल्टीमेटली द पेशेंट मे डाई इफ़ वी आर नॉट एबल टू कंट्रोल द शॉक इन टाइम। अब आ जाते हैं हम कार्डियोजेनिक शॉक में। उसके अंदर भी सेम प्रॉब्लम है, फ्लूइड बॉडी से कहीं नहीं जा रहा, सर्कुलेशन से भी बहुत ज़्यादा इधर उधर नहीं जाता इसके अंदर। उसके अंदर के कार्डियक फेलियर हो गया। कार्डियक फेलियर का है दैट मे बी बिकॉज ऑफ सम कार्डियोमायोपैथी, बिकॉज ऑफ इस्कीमिक अटैक। सो वेंट्रिकल इज़ नॉट एबल टू पुश द राइट अमाउंट ऑफ द ब्लड टू मेंटेन द ब्लड प्रेशर। ब्लड प्रेशर ही मेंटेन नहीं कर पाएगी क्योंकि फ्लूइड प्रॉपर नहीं पुश हो रहा, ब्लड प्रॉपरली सर्कुलेशन में आगे पुश नहीं हो रहा। जब पुश नहीं हो रहा तो इसका मतलब है कि ब्लड प्रेशर डिक्रीज हो जाएगा, गिर जाएगा, टिश्यू परफ्यूजन गिर जाएगा, ऑक्सीजनेशन ऑफ टिश्यूज गिर जाएगा एंड मेटाबॉलिक एक्टिविटीज़ विल बी डिस्टर्ब्ड। अब आ जाते हैं हम न्यूरोजेनिक शॉक। न्यूरोजेनिक शॉक के अंदर क्या है, आपका जो सिंपैथेटिक एक्टिविटी है दैट causes the constriction of the arterioles and the capillaries which maintain the resistance, because of which the blood pressure is maintained. Because of sudden trauma to the spinal cord, there is sympathetic activity to the vascular system is lost. जो एक रेजिस्टेंस बना के रखती हैं वेसल्स, कैपिलरीज और आर्टीरियल्स, अब उनका रेजिस्टेंस अब वो डायलेट हो गए। जब वो डायलेट हो जाएंगे तो उसके अंदर क्या होगा, एक तो पूलिंग हो जाएगी और दूसरा ब्लड प्रेशर गिर जाएगा। सो सिंपैथेटिक एक्टिविटी ख़त्म हो गई। नाउ देयर इज़ पूलिंग ऑफ द ब्लड एंड द पेशेंट विल गो इनटू शॉक। So this kind of shock usually occurs in case of spinal cord injuries. ट्रांजैक्शन हो गया, सिंपैथेटिक एक्टिविटीज़ जो मेंटेन करके रखती हैं सर्कुलेशन को, और यू कैन से द टोन ऑफ कैपिलरीज एंड द आर्टीरियल्स इज लॉस्ट। नाउ कम्स द एनाफिलैक्टिक शॉक। एनाफिलैक्टिक शॉक में भी समथिंग लाइक इसी तरह का कुछ होता है। ऑल ऑफ अ सडन आपने कुछ खाया, काजू खाया, बादाम खाया, कुछ भी खाया, एकदम आपको लगा कि चक्कर आने लग गए, आप गिर गए, उसके बाद आपका बीपी, पल्स सब गिर गया। तो इसके अंदर भी इमीडिएटली एक रिएक्शन होता है जिसके अंदर आपका कैपिलरीज परमेबिलिटी इंक्रीज हो जाती हैं, वेज़ोडाइलेटेशन हो जाता है, सिंपैथेटिक एक्टिविटी हो जाती है, देयर इज़ ब्रोंकोस्पाज्म। सो ऑल दीज हिस्टामिन related things usually happens. So in this case also the patient's blood pressure falls. So when the blood pressure falls the patient will go into shock, और वही सेम फीचर शॉक के जो और तरह के शॉक्स में होते हैं वो इसमें भी हो जाएंगे। So these are the various things that usually occurs in the shock. Usually जब पेशेंट शॉक में जा रहा होता है तो एक उसका जो मीन आर्टीरियल प्रेशर है वो गिरने लगता है। उसके गिरने की वजह से हाइपोपरफ्यूजन होगा। हाइपोपरफ्यूजन से फिर आपका डिरेंज्ड मेटाबॉलिक एक्टिविटीज़, एंड व्हेन द प्रोसेस कीप्स ऑन गोइंग एंड द you can say preventive measures fail to stop the progression of the shock. So one by one organ fails, then other, then other, then other. So ultimately the death of the patient occurred. तो पेशेंट की डेथ हो जाती है। तो ऐसे में जो कॉमन फीचर्स हैं शॉक के, तो वो जैसे अब आप लगाइए कि hypovolemic shock ही हो गया, तो generally the features which are present in some features are generally common. So whenever the things occur in shock, these usually occurs in a very rapid pace, कि बॉडी के जो ऑटोमेटिक मैकेनिज्म है, जो कंट्रोल करने के जो मैकेनिज्म है, उसको बाईपास कर जाते हैं। इतनी जल्दी ये सब सिस्टम शुरू होता है। जो अगर ब्लड लॉस धीरे धीरे हो रहा है तो बॉडी के जो कंपनसेटरी मैकेनिज्म हैं वो सब कंपनसेट करके पेशेंट को शॉक में नहीं जाने देंगे। लेकिन जब यही प्रोसेस एकदम रैपिडली हो जाता है तो बाय द टाइम बॉडीज़ ओन प्रोसेस और सिस्टम कम्स इनटू प्ले, जब आप बॉडी के अपने जो प्रोटेक्टिव मैकेनिज्म हैं जब वो काम करना शुरू करेंगे, उससे ही पहले पेशेंट शॉक में जा चुका होगा। तो अगर वही लॉस धीरे धीरे होता है तो वो बॉडी के जो प्रोटेक्टिव मैकेनिज्म है, जो प्रोटेक्टिव सिस्टम है ब्लड प्रेशर को मेंटेन के लिए, वो भी अपने अपने धीरे धीरे टेक ओवर करने लगते हैं, तो पेशेंट शॉक में नहीं जाता। तो एग्जैक्टली होता क्या है, पेशेंट आपको बोलेगा कि उसको चक्कर आ रहे हैं, आँखों के आगे अंधेरा आ रहा है, पसीना आ रहा है, बहुत ज़्यादा प्यास लग रही है, और आप जो अगर देखेंगे तो पल्स एकदम फीबल, टैकीकार्डिया, ब्लड प्रेशर इज़ गोइंग डाउन, यूरिन आउटपुट इज़ आल्सो गोइंग डाउन। तो ये सारे चीज़ें जो हैं आपको लगेगा कि पेशेंट शॉक में जा रहा है। तो जब पेशेंट का सिस्टोलिक प्रेशर 90 मिलीमीटर ऑफ मर्करी से नीचे जाएगा तो जो आपका रीनल परफ्यूजन है वो ख़त्म हो जाएगा। तो इसी तरह से एक के बाद एक ऑर्गन, कभी आपका जो डाइवर्जन होता है वाइटल ऑर्गन की तरफ ज़्यादा रहता है, बॉडी मेंटेन करके रखती है, तो उसी हिसाब से एक के बाद एक ऑर्गन फेल होने लग जाएंगे। सो व्हेन एवर पेशेंट इज़ इन शॉक, जब आपको पता लगता है कि उसका बीपी कम हो रहा है, टैकीकार्डिया बढ़ रहा है, फोरहेड पे स्वेटिंग है, कोल्ड, क्लैमी, मॉइस्ट एक्सट्रीमिटीज़ हैं, ठीक है, स्किन टर्गार, जो इलास्टिसिटी ऑफ स्किन वो भी नहीं है, तो all these features give rise to give indication that the patient is going in shock. हाइपोवोलेमिया में आपको दिख जाएगा कि फ्लूइड लॉस हो रहा है, नोजिया, वॉमिटिंग, लूज मोशन, एक्सटर्नल लॉस फ्रॉम द ट्रॉमा साइट, injury site or blunt injury chest, blunt injury abdomen, blood is accumulating in the peritoneal cavity and the pleural cavity. In case of septic shock, all the features of shock will be there. There may be, you can see the clear cut focus of infection will also be present, mainly in case of septic shock. The gram negative bacteria are more common. That means patient may be suffering from some intestinal perforation or UTI or kidney infection. So all these two common things, these contain gram negative organism which are mainly responsible for septic shock, though the septic shock can also be caused by gram positive organisms. Even fungus can also cause septic shock. Similarly, in case of anaphylactic shock, वो भी हमने डिस्कस कर लिया कि कोई all of a sudden allergic reaction to any drug, any food article that can occur. आपने जैसे खाया एकदम से आपको कुछ होने लगा, चक्कर आए, आप चक्कर खा के गिर गए. देन कार्डियोजेनिक शॉक. कार्डियोजेनिक शॉक में भी आपको पता चल जाएगा कि पेशेंट को ऑलरेडी कार्डियक प्रॉब्लम थी या पेशेंट ऑलरेडी ट्रीटमेंट ले रहा था, तो उसके बाद ऑल ऑफ ए सडन वो कोलैप्स कर गया. तो जब आप छोटा सा भी कोई एक इको करके अल्ट्रासाउंड करके देखेंगे तो आपको पता चल जाएगा कि ईसीजी करेंगे तो भी आपको पता चल जाएगा कि इस तरह का प्रॉब्लम जो है कार्डियक इवेंट की वजह से हुआ है. नाउ कम्स योर न्यूरोजेनिक शॉक. न्यूरोजेनिक शॉक में क्या, पेशेंट को ट्रॉमा हुआ, स्पाइनल कॉर्ड इंजरी हो गई, उसके बाद पेशेंट शॉक में चला गया, बीपी गिर गया, उसका यूरिन आउटपुट गिर गया, टैकीकार्डिया बढ़ गया. जब आपने अल्ट्रासाउंड किया, फ्लूइड लॉस हो सकता है कि कई बार पेल्विक फ्रैक्चर के अंदर या स्पाइनल के अंदर थोड़ा बहुत आसपास हेमेटोमा आपको मिल जाएगा, लेकिन इतना सीवियर ब्लड लॉस नहीं होगा कि पेशेंट शॉक में चला जाए. तो मेन रीज़न इसके अंदर क्या है कि सिंपैथेटिक एक्टिविटी जो एक रेजिस्टेंस आर्टीरियल्स और कैपिलरीज मेंटेन करके रखती हैं वो ख़त्म हो जाता है. तो देयर इज़ पूलिंग ऑफ द ब्लड इन द कैपेसिटेंस सिस्टम दैट इज़ प्रोड्यूस्ड नाउ बाय द आर्टीरियल्स एंड द कैपिलरीज. वहाँ पूल हो जाएगा तो ब्लड हार्ट के पास कम जाएगा, तो कम पंप होगा तो ब्लड प्रेशर गिर जाएगा. सो इन ऑल दीज केसेस व्हेन यू गेट टू नो, जब आपको कारण पता लग जाएगा, कॉज पता चल जाएगा कि शॉक का क्या कॉज है, तो उस हिसाब से आपने उसको ट्रीटमेंट देना. हाइपोवोलेमिक शॉक के अंदर आपको ज़्यादा कुछ नहीं करना है, फ्लूइड रिप्लेस करना है. और दूसरा आपने एक चीज़ और देखनी है कि कोई इंटरनल इंजरी तो नहीं है, कोई ब्रेन इंजरी या और इस तरह की इंजरी तो नहीं है जो शॉक के साथ साथ वो आपको एक्सप्लोर करने की ज़रूरत है कि नहीं है. सो जो अगर पेशेंट को नोजिया वॉमिटिंग है, लूज मोशंस है, तो आपको इलेक्ट्रोलाइट्स भी रिप्लेस करना है. जो अगर ब्लड लॉस है तो ब्लड लॉस की बजाय आपको ब्लड ही देना पड़ेगा, साथ में आप एक मेंटेनेंस फ्लूइड रिंगर लैक्टेट्स वगैरह आप दे सकते हैं. सेप्टिक शॉक के अंदर आपको जो अगर कल्चर मीडियम ब्लड कल्चर मिल जाता है तो यू गेट टू नो द ऑर्गेनिज्म सो दैट यू कैन स्टार्ट द स्पेसिफिक ट्रीटमेंट विच इज़ मोर, you can say, the specific to the causative organism. Similarly, in case of neurogenic shock जिसके अंदर स्पाइनल कॉर्ड इंजरी है, तो हमारे को यही थोड़ा सा करना है कि वी हैव टू रेज द फुट एंड ऑफ द पेशेंट. स्पाइनल ट्रॉमा कोई एकदम हमारे को स्पाइनल सपोर्ट दे के रखना है. वी हैव टू मूव द पेशेंट लाइक ए लॉग. कोई भी रिलेटिव मूवमेंट स्पाइन के अंदर नहीं होना चाहिए. मतलब जो ट्रॉमा हो चुका है वो तो रिवर्ट नहीं होगा, लेकिन हमने देखना ये है कि उससे ज़्यादा और चोट ना लगे स्पाइनल कॉर्ड को. एनाफिलेक्टिक शॉक के अंदर हमारे को वही मेंटेन करने के लिए एविल डेकाड्रॉन वगैरह सपोर्टिव ट्रीटमेंट देना है, फ्लूइड देना है और स्टीरॉइड्स वगैरह हम दे सकते हैं. और स्पेसिफिक कोई ऐसा चीज़ जो खाई है जिसका एंटीडोट हो सकता है तो वो हम एंटीडोट दे के वो प्रिवेंट कर सकते हैं. सो इसी तरह से जब मैनेजमेंट की बात आती है शॉक की, तो मैनेजमेंट में आपने क्या करना है, पहले तो आपने डिफ़ाइन करना है कि किस तरह का शॉक है. 1. देन साइंस एंड सिम्टम्स ऑफ द शॉक. Then if particular type of shock is being asked, then you have to give specific things about that type of shock. Then how you will diagnose? So you have to examine the patient, take first history, then examine the patient. In history you will get to know that patient is already having some septic focus in the body. That may be some gut infection, there may be perforation, there may be UTI, kidney infection, whatever it may be. And patient is immunocompromised because of any reason. That may be chemotherapy, antibiotics, in case of perforation, not going for surgery but taking antibiotics or like this. So then you have, if you find something, some material for the culture sensitivity, send for culture sensitivity. Do the ultrasound of the abdomen to rule out any collection in the abdominal cavity. Then do the X-ray chest to find out any pathology in the lungs. Then examine the inguinal area, there may be some obstructive or strangulated hernia will be there. Then you have to find out. So before giving any investigation to the patient, you have to thoroughly examine the patient from top to bottom. Then based on the finding of the examination, you have to subject the patient to the investigation. Then compile the findings of your history, examination and investigation and make a particular diagnosis. Now suppose your diagnosis is septic shock. आपको कल्चर भी मिल गया और आपको ये भी मिल गया कि फोकस कहाँ पर है. तो फोकस सपोज जीआई ट्रैक है या यूरिनरी ट्रैक है. तो मोस्ट कॉमन थिंग इज़ दैट पेशेंट इज़ हैविंग ग्राम नेगेटिव. आपको कोई ऐसा फोकस नहीं मिला कि आपको लगे कि फंगस इन्फेक्शन है या ग्राम पॉजिटिव है या कुछ है. तो इस तरह के इसमें हम क्या करते हैं, हम ब्रॉड स्पेक्ट्रम एंटीबायोटिक शुरू करते हैं स्पेसिफिक फॉर द ग्राम पॉजिटिव, नेगेटिव, एनारोब्स. सो दिस टाइप एक हमने एंटीबायोटिक शुरू कर दिया. उसके बाद जब कल्चर आएगा देन वी कैन चेंज द स्पेक्ट्रम ऑफ द एंटीबायोटिक. Similarly, we have to maintain the urine output, we have to maintain the oxygenation of the tissues by giving the oxygen, and we have to replace the fluid. So whenever such kind of things and when you are not at a very advanced stage, advanced hospital, you don't have much monitoring system. So the best monitoring system in this kind is the condition of the patient. If there is improvement, number one, pulse rate, blood pressure and the urinary output and the oxygen saturation of the tissues. So जब ये आपको लगता है कि धीरे धीरे यूरिन आउटपुट भी आने लग गया है, यूरिन क्लियर है और साथ में पेशेंट रिस्पॉन्ड कर रहा है, पहले जो पेशेंट ड्राउजी था वो थोड़ा सा कॉन्शियस स्टेट में आपको रिस्पॉन्ड कर रहा है, पहचान रहा है, टेकिकार्डिया भी कम हो रहा है, ब्लड प्रेशर भी बढ़ रहा है, दैट मीन्स वट एवर द ट्रीटमेंट यू आर गिविंग, दैट पेशेंट इज रिस्पॉन्डिंग टू दैट ट्रीटमेंट. You have to continue that treatment till the report of the culture sensitivity is available. On the basis of that culture sensitivity, you can change the antibiotics. So this way you can write about the shock. So I am also posting beside all this thing that I have discussed right now, the specific type of shock, how you can manage, how you can diagnose, what are the various signs and symptoms. But that does not mean that if long question, 10 marks question comes. So suppose define shock, what are the various types of shock, how you will manage, diagnose and manage the septic shock, treat, or you can simply, there may be shock. So you have to be very specific. Welcome to my new system of teaching and learning, that is fun, learn and earn system. So today's topic is shock. So you must be feeling shock. So what is that shock? So let's start with something else before starting with the shock. You must have seen rivers. So when these rivers are full of water, so they do lot of purpose. So what are the purpose that these rivers solve? One is the potable water for drinking. Second is water for irrigation. Third is fertile soil. So whatever may be the cause of decrease in the supply of water in these rivers, so that will affect the water supply for drinking. Second, it will affect the water for irrigation, and ultimately it will affect the crop yield. Third is it will also affect the transport if the river is big and is used for small transport purpose. Third, when the river water is not there, the soil around the banks of the rivers will not be fertile. So whatever may be the reason of decrease in the water supply, so all these things will be affected. So there may be some construction of the dam outside the country borders. So that country may restrict the water release for the next country. There may be landslides in the hilly areas that may cause the diversion of the river route. There may be construction of small irrigation canals that can also cause the decrease in the supply of the water in the river. So whatever is the cause, ultimately that lead on to decrease in the water supply, and it will affect the various things we have mentioned. Similarly, in case of shock, what exactly is shock? Shock is basically there is abnormality in the circulation that leads on to the decreased perfusion of the tissues, and ultimately there is anaerobic respiration by the cells. So when these tissues are affected because of decrease in the circulation, that means circulation decrease means there is effect on nutrition, effect on the oxygen supply. Third is decreased vascular volume, and it will cause the decrease in the blood pressure. When this blood pressure decrease, what will happen? The renal perfusion will also decrease. That will cause the decrease in the what? Decrease in the urine output. So all these constitute the shock. So whatever may be the reason of the shock, the one thing is common, that there is decreased in the volume of circulating blood. So that circulating blood is mainly responsible for your renal perfusion, that maintains the good urine output and the excretion of the toxic materials from the body. Second is maintenance of the blood pressure, transport of various nutrients and the oxygen to the various tissues and cells of the body. So all these things will affect your oxygenation of the tissues. So it is the abnormality of the circulation, just hold on, along with inadequate organ perfusion. Then there is decrease in the oxygenation of the tissues and impaired cellular metabolism. That means in the absence of oxygen, the cells will go into anaerobic respiration, and that is not good for long survival of the cells. So what are the various causes of the shock? So whatever is the cause of the shock, ultimately it will cause the decrease in the volume of the blood that is in the circulation, and ultimately that will affect the many functions of the body. So that fluid loss from the body can be the hypovolumic shock, septic shock can be there, neurogenic shock, cardiac shock, and the anaphylactic shock. So whatever may be the reason, all these shocks ultimately lead on to the decrease in the intravascular volume. So that decrease in the intravascular volume may be because of loss of fluid or blood from the body, that causes a hypovolemia. In septic shock, there is increased capillaries permeability that causes the loss of fluid to the third space. Ultimately, the fluid remains inside the body, but that fluid is not into the vascular system to maintain the perfusion of the tissues. Then similarly, in case of neurogenic shock, in neurogenic shock, there is loss of sympathetic activity that lead on to the dilatation of the vessels and decrease in the perfusion of the tissues because of decrease in the blood pressure. Similarly, in case of cardiac shock, in cardiac shock, the pumping station, that is the heart, is at fault. So what will happen? That heart will not pump the blood, and ultimately there will be no blood to the tissues or the decreased blood to the tissues, and ultimately what will happen? There will be decreased perfusion and there will be decreased metabolic rate, and ultimately tissues will go into anaerobic respiration. Then is the anaphylactic shock. In anaphylactic shock also there is peripheral vasodilatation. So that can also lead on to decrease in the tissue perfusion. So this anaphylactic shock may be because of hypersensitivity to the drug, hypersensitivity to the food, or that may be because of insect bite. So that can lead on to severe anaphylactic reaction that can cause the severe your bronchospasm, your laryngeal edema, along with other features of shock. So these are the various kinds of shock, and ultimately the single result because of all these conditions of the shock is hypoperfusion of the tissues and impaired cellular metabolism. So let's talk with hypovolemic shock. So in case of hypovolemia, so as we have already discussed in the basics of general surgery, first chapter, that water constitutes the 75 to 80% of the human body, and most of that water is present in the circulation. So blood is also the part of that volume of water. So part of the water is present in the muscles, other tissues, and the part is present in your circulation. So loss of fluid from the body, whether it is a blood, so loss of blood is mainly because of trauma. That is the single most common cause of loss of blood from the body. So that loss of blood may be obvious, that is visible from outside, and second is hidden or non-obvious. So that blood is not visible, but that blood is being lost from the circulatory system. So where that blood is going? So that blood is going into the other spaces, losing out from the circulatory system. So it may be losing into the pleural cavity in case of chest trauma. It may be going into the peritoneal cavity in case of your abdominal trauma. So that abdominal trauma usually is blunt trauma. That's why blood is not visible outside and it is collecting inside the peritoneal cavity. So there may be injury to the liver, injury to the spleen, major vessels, mesenteric vessels. So all these can cause profuse bleeding, and ultimately there is collection of blood in the peritoneal cavity, but it is not visible from outside, and ultimately the blood is losing from the circulation. That loss from the circulation will lead on to decreased blood pressure, decreased perfusion of the tissues, and impaired cellular metabolism. Second main cause of loss of fluid from the body is sweating, vomiting, and loose motions, that is diarrhea. So in case of excessive sweating, when the person is working in a hot environment, hot and humid environment, and is not taking the fluid, so most of the fluid will be lost in the form of sweat. In case of diarrhea, the fluid will be lost as a loose motions. Lot of fluid along with the electrolytes will be lost from the loose motions. Similarly, in case of repeated vomiting, the fluid will be lost along with the loss of nutrients and elements, sodium, potassium, and chloride. So in all three cases, there is loss of fluid, that is in the form of sweat, in the form of loose motions, in the form of vomitus. So all these forms also cause loss of elements, sodium, potassium, and the chloride. So whenever we have to replace the fluid, we have to keep in mind that we have to replace these elements also. So let's dive into mind map. So ultimately what happens? There is decreased circulatory blood volume. So what are the various ways by which the fluid is lost from the body? This vomiting, excessive sweating, loose motions. Third space, loss in the inflammatory conditions. So that fluid is moving out of the circulation, but it is accumulating in the third space. That may give rise to puffiness of the face, whole of the body. The fluid is not going out of the body, but it is going out of the circulation. And then when it is going out of the circulation, that means blood pressure will go down. So blood pressure when goes down, it will cause the decreased perfusion, impaired cellular metabolism. Similarly, in case of burns also, not 3, 4, 5%, when the burns are more than 10%, they cause significant loss of fluid, significant loss of heat from the body, significant loss of proteins also. So that fluid that is lost in the burns is containing proteins. So we have to replace the proteins also in case of burns. So what are the various causes of blood loss? So as we have already discussed, the blood from the body, if it is losing, it can be visible to the naked eyes, or it may be hidden or concealed. So obvious loss of blood that mainly occurs in the trauma, and the second cause is hematemesis, that means blood in the vomitus. So from where that blood is coming? That blood is coming from the esophageal varices, or maybe loss from the some ulcer in the stomach wall. So that can cause loss of significant amount of blood that can lead on to hypotension and hypoperfusion and impaired cellular metabolism. Then the concealed blood, as I have discussed, there may be blunt trauma and ruptured aortic aneurysm that can also give rise to concealed loss of blood from the circulation into the peritoneal cavity. So how we can categorize that? If the patient is suppose is 70 kg in weight, approximate blood volume is 5 liters. So that amounts to your 80 ml per kg body weight. So 4 categories we can divide the shock, hypovolemic shock. So it can be mild when the loss is less than 75 ml of fluid or the blood, that is less than 15% of the total blood volume. Second is 750 to 1500 ml, that is 15 to 30% of the blood volume. Third stage is 1500 ml to 2000 ml, that is 30 to 40% of the blood volume. And when the loss is more than 2 liters, that is more than 40%, the mortality rate is very high in these cases. So whenever the blood that is losing from the body is obvious, as in case of fracture thigh, fracture limb, that is open wound is there, or somewhere else in the limbs open wound is there, we have to apply the pressure bandage and minimize the loss of the blood from the body. So that hypovolemic shock also depends upon the how much amount of blood or the fluid is lost from the body. So minimal symptoms will be present in your stage 1, 2, that is less than 750 ml or 750 to 1500 ml of fluid lost from the body. So these minimal symptoms will be tachycardia, pulse rate will be more than 100, decreased your pulse pressure, and as we have already discussed, there is decreased tissue perfusion. So when there is decreased tissue perfusion, the body tries to cause the vasoconstriction and restrict the blood into the peripheries. So peripheries will be cold and patient will look pale. So these are the minimal symptoms when the loss of blood is or fluid is not much. And when there are classical symptoms of shock. So these classical symptoms, when the tachycardia is more than 120, hypotension is present, tachypnea is present, pallor and cold peripheries are present, decreased conscious level of the patient, and oliguria. So in most of the time, patient at this stage is confused, he may not be responding properly. So from mind he is confused and he may be asking for water for drinking. There may be profuse sweating over the forehead, and similarly the peripheries will be cold. So when the loss of fluid is more than 2 liter, 1500 to 2 liter, so there are so much symptoms that tachycardia goes beyond 150 degrees, hypertension will be there, diastolic pressure will not be measurable, then similar other findings, cold peripheries, unconsciousness, and anuria. So oliguria and then followed by anuria. Because the blood pressure is so low, if the systolic goes less than 90 millimeter of mercury, the perfusion of the renal tissues is decreased very much. So that decreased renal perfusion lead on to decreased urine output, and ultimately there will be anuria, that kidneys are not able to produce any urine. So in these cases, just a minute. So in all these cases, there is loss of fluid from the body. So in treatment, the main part of the treatment is replacement of the respective fluid. Respective fluid means if there is loss of blood, we have to replace it with the blood. Though initially we can start with other intravenous fluid along with electrolytes. As soon as the blood is available, we have to transfuse the blood, because the blood has got a oxygen carrying capacity that is absent in case of your intravenous fluid. So if we have to maintain the blood pressure along with the increased perfusion of the tissues and oxygenation of the tissues, we have to transfuse the fresh blood to the patient. Now dive into the treatment of the hypovolemic shock. So as there is any shock except the mild symptoms of the shock when the patient is conscious, we don't have to look for the airway. But when the loss of fluid is more than 1500 ml or between 750 to 1500 ml, so depending upon the conscious level of the patient, we have to maintain the airway of the patient. So this airway we can maintain by either by if the putting the oral airway to prevent the tongue fall, and we can give the 100% oxygen to the patient. If the conscious level decreases further, we may have to intubate the patient and then ventilate the patient, give the oxygen through the ventilator. So elevation of the foot end is generally observed in all the patients with shock, because we have to decrease the circulation from the peripheries and to increase the mobilize the blood into the central circulation. And then we have to, when all these kind of patients come to you in the emergency, so immediately the relatives of the patient or other people who have brought the patient to the hospital if the patient is of a road traffic accident. So what happens in that case? In that case, visible blood is there, obvious, or there may be concealed blood, and you have suspicion that patient might have suffered chest injury or the abdominal injury. So in that case, you have to immediately apply large bore 16 or 14 bore cannula, because at the time of admission when the patient comes to you, he may be having some blood pressure. So as the blood pressure goes down, the venous system will collapse and you will not find any vein for your cannula. So in that case, you will keep on pricking the skin, but you will not be able to introduce the cannula into the venous system. So this is the first priority. As soon as you suspect that patient is having severe loose motion, diarrhea, road traffic accident, bleeding, so immediately the first step should be, after maintaining the airway, you should initially put the large bore cannula and start the fluid to the patient. So this ideally it should be in the antecubital fossa, because the large vein is there and we can rush the fluid very fast. So simultaneously when we apply the cannula, we must take the samples from the patient, because these samples are required for the biochemistry, that is your complete blood count, urea, creatinine, liver function test, and the cross matching. That is the most important, because in these cases we have to transfuse the blood, and without cross matching we cannot transfuse the blood. So in biochemistry, that electrolytes, renal function test, and complete blood count. So what are the various fluids that we can give to the patient? First are the crystalloids with plasma expanders. Crystalloids means your ringer lactate, and plasma expanders your hemaxil. So these are gelatinous substances, and initially we have to start with the crystalloids, and after that we can give the plasma expanders till the blood is available for transfusion. So we have to maintain the circulation so that kidneys keep on functioning. Once the circulation is so much down that kidneys go into acute tubular necrosis, and sometimes it becomes very difficult to revive those kidneys, we may have to subject the patient to dialysis for few days, or sometimes kidneys may go for your failure. Kidney failure may be permanent. So as I have told you, whenever the external wound is visible, it is bleeding, we have to give the compression bandage. So how we can measure the amount of fluid which we are giving may not be more or it should not be less. So we can give central venous pressure cannula and we can monitor the central venous pressure. So by measuring the central venous pressure, we can maintain the pressure of the central vein and then we can monitor the amount of fluid that is required. So we can check the response of the fluid that we are giving. If the central venous pressure is increasing with fluid, that means patient is responding to your fluid therapy. As we have already told and discussed that with decreasing blood pressure, your renal perfusion also goes down. That renal perfusion goes down may cause the decrease oliguria or totally no urine. That means you have ultimately anuria, there will be no urine. So that stage how we can detect? So that we can detect by introducing the urinary catheter, that is Foley's catheter, so that we can monitor 1 hourly urine output of the patient. If by giving the fluid the output is increasing, that means patient is improving. So that urine output should be at least 1 ml per kg per body weight. So basic observations that we have to monitor for a shock patient which is undergoing the treatment. So all those things which are decreasing down, we have to monitor those whether these are regaining their original position or not, like temperature, because the peripheral temperature is decreased because of hypoperfusion and vasoconstriction. If the body and peripheries are regaining the temperature and the temperature is increasing, that means the patient is responding. Pulse, if the tachycardia is decreasing, that means the patient is responding. Blood pressure, if it is increasing, that means the patient is responding. Respiratory rate will decrease, conscious level will increase, urine output will also increase. That will be visible in the urobag. So definite treatment of the shock will be your definite cause we have to locate. If there is splenic injury, we have to do the laparotomy and we may require splenectomy to stop the bleeding. If liver trauma is there, the significant amount of blood is not there, but we have detected that liver trauma is there. So we can many times manage that conservatively, and if there is loss of liver damage, then we may have to give the compression over the liver surface, or we may have to suture the liver surface to stop the bleeding. So now, what are the various factors that lead on to failure of your resuscitation? So patient is not responding to your treatment. So there must be some reason. If some vessel is there, over that you are pouring fluid, and from below it is the same amount of fluid is moving out of the vessel because there is hole at the bottom. So what will happen in that case? Vessel will never fill. So whatever amount of fluid or blood we are giving, if some space is there or some site is there from which the blood is continuously losing from the body, or fluid is losing from the body, so whatever amount of fluid or blood we give, the blood pressure will not increase. So in those cases, similarly in case of liver trauma, in case of splenic trauma, continuous loss of blood is there into the peritoneal cavity. Here we are giving the fluid, but the blood pressure is not increasing. So in that case, we have to immediately do the laparotomy and stop the bleeding by doing the splenectomy or repair of the liver that has been damaged. So thank you very much, and the next chapter will be your septic shock. Thank you.